Hi, this is Dr. Reyes, your New York-based physical therapist. Ang topic natin ngayon ay mga exercises para mabawasan ang pain at inflammation sa mga pasyenteng may arthritic pain. So, based sa studies na ginawa, pag nag-increase ang range of motion or yung mobility ng knee, nababawasan ng inflammation, nababawasan ng pain. So ito yung mga exercises na ito na mag-i-improve ang muscle strength at mag-i-improve ang range of motion. So let's start now. So kailangan lang natin ng sturdy chair, alright, and 3 pounds ankle weights. That's it. Okay? So, number 1, mag-warm up exercise muna tayo. It's a pressure on, pressure off, knee to chest exercise. So, number 1, pull your knee to your chest with pressure on, pressure off. Pressure on, pressure off, 5 repetitions. Okay? Pressure on, pressure off, 4 and 5. If you have pain, pagka ginagrab nyo yung tuhod nyo, use your hand behind the knee so gravity can bend your knee just like this. Alright? So if you have pain, you can just do this. Pressure on, pressure off. Pressure on, pressure off. Pressure on, pressure off. 5 repetitions, 3 sets of 5. The other side. On and then off. On and then off. That's 3, 4, and then 5, right? So the purpose of this one, it's a warm-up. If you increase the range of motion, you move it, you increase the lubrication, you increase the blood flow, the pain decreases. All right, so that's a pressure on, pressure off, warm-up exercise. Number 2, so sa akin, for a start, for men, maybe 2 to 3 pounds. For beginners, so women, start with 1 to 2 pounds, okay? So kung masyado namang lightweight sa inyo, you can add as much as 5 pounds. It's up to you. Make sure you show this to your medical doctor, to your primary care doctor, or to your physical therapist pag mag-i-start ng any exercise program, okay? So let's add the 3 pounds. Again, you can use this without the ankle weights. Okay, so number 2, we're gonna do hip flexion. So that's 3 sets of 10. So 1, 1, 2, 2, 3, 3. Make sure you're in an upright position. Don't slouch. Don't lean back. So upright position. Engage your core muscles. All right. So 4, 4, 5, 5. So you're strengthening the hip flexors, itong iliopsoas muscles, your quadriceps muscles, right there. And that's 3 sets of 10. After 10 repetitions, you rest, okay? And then you start again. So the next exercise is the knee extension. All right, so this is an easy one. You strengthen your quadriceps. Make sure you engage your core, breathing, and then upright posture. Okay. So again, I'm using 3 pounds ankle weights, and then let's do this 3 sets of 10. Hold it for 1 to 2 seconds. Make sure you do a full extension. You can add dorsiflexion or your toes towards you. Okay. You see my toes are up. All right, use your hands as just to stabilize the knee, and then back. All right, 10 repetitions. So you always strengthen. This is a very common exercise. We strengthen the quadriceps. We strengthen the knee muscles and the hip muscles too, because that's all connected. That's a 2-jointed muscles. So that's 3 sets of 10 each leg. So that's the quadriceps. And then the next exercise is the open leg hip abduction. Ito naman, you're just opening your leg. Ganyan, no? Opening your leg. So you're gonna use your hands to give resistance. Ayan, lagay nyo lang yung kamay dito sa gilid. Alright, dito sa side ng tuhod. So you hold it, not too hard, just a medium pressure. Alright, so you close your knees right here together. Put your knees together and then slowly open it. So that's 1. Again, we're gonna do this 3 sets of 10. You don't need to use resistance. You can just do slow open, and then that should be enough. All right, for beginners, doing it in repetitions, 3 sets of 10. And then once you get better, yan, sabi nga sa studies, once you strengthen different muscle group, nag-i-improve ang stability ng knees, and then it will actually decrease knee pain. Mag-i-improve yung function, mag-i-improve magdi-decrease ang inflammation. So this is a great exercise. You're covering the lateral side, this muscles right here. So first, we're working on the quadriceps. Now dito naman sa side natin, okay? So if you want to increase yung resistance, you can put your hands, apply medium pressure, just like that. So you're working on your leg muscles, right there, and you're also working on your shoulder muscles. If you have pain in your shoulder, don't do this, okay? So that's 3 sets of 10, 30 times. Okay, just like that. All right, good. So that's the for the lateral muscles. Now we're gonna work on the inner muscles. All right. So ito naman i-work natin tong inner muscles. Now you can use your hands, both hands, and you can squeeze it. This is an isometric exercise. Pagka sinabing isometric exercise, you're actually not moving your joints. You're not actually moving it. You're just pressing it. All right. So there's isometric resistance exercise. So you're moving your leg. You're squeezing your hands. All right. Okay. You can use one, but I like using both. So it's a bigger space. Like I usually use ball, but kung nasa labas kayo, or if you're outside or you're inside the car, you can start doing this. Use both hands and squeeze it, and hold it for, I would say, 5 seconds. 1, not too much, okay? 1, 2, 3, 4, 5. It looks easy, but it's not. You can start with maybe 10, 20 repetitions, but the goal is 3 sets of 10, okay? Again, squeeze it, medium pressure, 1, 2, 3, 4, and 5. So the last exercise is standing on one leg with hip extension. So you wanna strengthen the hamstring too. So we covered the front, the side, dito sa lateral side, and now itong hamstring natin. And in addition to stability exercise and balance. Kasi alam nyo, most patient, kaya sila natutumba pagka sumakit yung tuhod and standing on one leg, or when they're walking. Kasi pagka naglalakad, we have a moment of standing on one leg. That's when pagka sumakit ang tuhod, doon natutumba at nagkakaroon ng fracture, nasasaktan. So ito, very important exercise, standing on one leg with hip extension. So we're covering the back muscles, or the thigh, the hamstring muscles. All right. So standing on one leg, you can use a sturdy chair for balance. And if you can do it without holding, that's even better if you can. But if you're just starting, hold on to a sturdy chair and then bend your knee, and then make sure you're standing upright, not slouch, standing upright, engage your core, and maybe hold this for 5 seconds if you can. And then bend your knee, engage that hamstring, and then add some hip extensor. All right, so 5 seconds. 1, 2, 3, 4, 5. You're using your glutes, your hamstring, and the stability on one leg. Now you alternate. You can do this 10 repetitions. Hold it for 5 seconds. Now we can add, like, without holding on the chair, extend your hip, hold it for 5 seconds. Or you can use two fingers. 1, 2, 3, 4, and 5. Alright, so last one, pakita ko sa inyo, 10 repetitions. Extend your hip, alright? You're using your glutes, your hamstring, contract that hamstring muscles, and then hold to the chair. And then 1, 2, 3, 4, 5. And there you have it. Yan yung mga exercises to strengthen. Start without the weights, and then once na nag-improve ang inyong condition, you can add weights and then you can hold it longer. Alright, so yun mga importante exercises effective sa aking clinic.